Are they ready?
Good morning, class, and good morning, Miss. Today we'll be presenting our health promotion prevention plan. The group consists of Tahila Downa, myself, Mira Primnat, Karishma Ramjatan, Safaya Basad, Liana Ramup, and Vanessa Springer. Unfortunately, Liana would not be presenting. Our table of contents consists of rationale for population choice, pressing health issues, health promotion prevention plan, the influence of the community and factors, utilization of the following strategies. The topic that we chose was women, and the topic that we chose to do based on women is endometriosis. I will now hand you over to Vanessa.
Rationale for population choice, which is endometriosis in women. Endometriosis is a chronic and often painful condition that affects millions of women worldwide. It is characterized by the presence of endometrial tissue outside the uterus, which can cause symptoms such as chronic pelvic pain, heavy menstrual bleeding, and infertility. Therefore, research on endometriosis is essential to improve our understanding of the condition and to identify new and effective treatments for women with endometriosis. By conducting research on this topic, we can gain insight into underlying causes of endometriosis and develop more targeted and effective treatments for the condition. This will not only benefit women with endometriosis, but also advance the field of gynecology and women's health more generally. I will pass you on to my other colleague.
Identify one of the most pressing health issues relevant to this population or setting. The present health issue is endometriosis. I will just be elaborating a bit further about it. Endometriosis is a painful disorder which occurs in women who are diagnosed with this ailment. The tissue that normally lines the inside of the uterus, the endometrium, grows outside the uterus. Endometriosis often involves the pelvic tissue and envelope of the ovaries and fallopian tubes. It can affect nearby organs, including the bowel and bladder. So during a menstrual cycle period, this tissue responds to hormone, and due to its location, frequently results in pain. It is very uncommon for endometrial-like tissue to be discovered beyond this area where the pelvic organs are located. According to Johns Hopkins Medicine, this condition affects an estimated 2 to 10% of women between the ages of 25 and 40. Women with endometriosis develop tissue that looks and acts like endometrial-like tissue. However, this tissue grows outside of the uterus instead of inside, and are found on other reproductive organs, either inside the pelvic or abdominal cavity. There are some possible explanations of what sparks the endometrial-like tissue to grow out of place, but the exact cause is still uncertain. However, there are some risk factors that can increase a woman's chance of developing endometriosis, such as never giving birth, menstrual cycle occurring more frequently than every 28 days, heavy and prolonged menstrual periods that last longer than 7 days, having a higher level of estrogen in your body, having a low BMI, body mass index, having structural issue with the vagina, cervix, or uterus that prevents the passage of menstrual blood from the body, or even a family history. Furthermore, a belief is that during a woman's menstrual cycle, some of the tissue may back up through the fallopian tubes into the abdomen, a type of reverse menstruation, where they then become attached and grow. Additionally, while research is ongoing as to the exact cause of the illness, studies have also shown that endometriosis can also transpire because of direct transplantation in the abdominal wall after a cesarean section. I will now like to pass you on to Mira.
For our health promotion prevention plan for this target population and settings, the sample health promotion prevention plan we designed was for women ages 25 to 40 in a community or area Princeton. The cultural identification, all ethnicities. The duration dates would be the 1st, 8th, and 15th of December. The risk factors or program goal would be to reduce the endometriosis among young women in Princeton. As you can see, we have 4 project objectives, which is define endometriosis to increase the awareness of the signs and symptoms, 2, to increase the awareness of the causes, and 4, to increase the awareness of the treatments. There will be a group going around Princeton to inform both young and middle-aged women of endometriosis. There will be conferences at certain venues with music and pamphlets with posters. Hence, the schedule will be followed as the 1st of December from 9 to 11 at Princeton West Secondary School. There will be a guest speaker from the Trinidad and Tobago Endometriosis Society with posters and pamphlets. The 8th of December will be 2 to 5 at the Hindustan Community Center with posters, pamphlets, activities, and musics. And the 15th of December will be 9 to 11 at Princeton District Health Facility with, again, a guest speaker from the Trinidad and Tobago Endometriosis Society with posters and pamphlets. After 3 months, we should do observation and assessment survey and get statistics from various health facilities within the area to determine the impact of the campaign if the objectives were met. One of this would be a poster and the other would be a pamphlet that would be distributed while the conference will be going on. I will now hand you over to Tahila.
So I will now be discussing how community factors can influence the successful implementation of our health promotion plan. Next slide. Stress. Environmental stress can cause inflammation, which can then worsen the pain of endometriosis. This can be a big factor that can hinder the implementation of the health plan as it can worsen the state of the patient. If they are attending seminars and being educated on how to care for their condition, these efforts will go to waste if they are not properly managing their stress, especially in a time like the pandemic where stress levels are particularly high. Next slide. Culture. Many women fail to get diagnosed because they assume that extreme menstrual pain is normal. Studies reveal that many women have been told that period pain is a part of life and they are expected to go about their day as normal. Therefore, women spend years in extreme pain every month without even considering that something may be wrong, because this is the mindset that has been taught to them. So if they have been taught that this is the norm and it's not a big issue, then despite what we teach them, if they don't see it as an important issue to resolve, then they will not put the knowledge that they've learned into implementation. Next slide. Support. Not having a supportive community can hinder the implementation of the health promotion plan. If women feel that their concerns are validated, this can give them the confidence and push they need to voice their pain and seek treatment for said pain. However, if they feel that lack of support, then they will be more hesitant to follow through with the health promotion plan as they would feel invalidated. So they would have the knowledge they need in order to implement the plan, but not the confidence that they would need to do it. Next slide. Employment is a big factor. There are many financial aspects of this illness, like medication, surgery, doctor visits, and diet changes. Especially the medication and doctor visits are expensive, as Trinidad and Tobago does not have a wide range of doctors specializing in endometriosis, nor do they have local medication. So most of the medication is imported and very expensive. This can be a hinder because despite having the knowledge learned on how to care for this illness, persons may not be able to afford the treatments in order to treat it. Especially during a global pandemic where many people are losing their jobs, it can be difficult to act on the knowledge that they would have learned. Next slide. Government funding. For illnesses like diabetes or high blood pressure, there are multiple government institutions dedicated to research and treatment. This is not the case for endometriosis, however. There are next to no non-profit foundations for this disease and no government foundations. This illness isn't seen as life-threatening, so there isn't much funding for it. This can hinder the implementation of the plan, as funding is needed for various uses such as supplying medication and hosting seminars and events to educate women on how to care for this illness. So if we would like to have seminars, educated women, we will need to hire speakers, we will need to get venues and stuff like that. And if we don't have government funding, then we cannot be able to carry out our prevention plan. Next slide. And lastly, education. Trinidad and Tobago's field of medicine is not as advanced as other places like the US. There are very little gynecologists that specialize in the treatment of this illness. A lot of doctors who treat this illness are general gynecologists, and this can lead to various issues like misdiagnosis or incorrect treatment because they don't have that education needed in order to separate endometriosis from other similar diseases such as pelvic inflammatory disease or irritable bowel syndrome. So this can delay the treatment process and they can spend years being undiagnosed. I'll now pass you on to my colleague.
Good afternoon. So today we will describe how you can utilize the following strategies of health promotion to implement our plan. So firstly, we have to formulate a public health policy. Our health policy is defined as goals for health at international, national, and local levels. It also specifies the decision, plans, and actions to be used to achieve these goals. The goal of the health policies is to protect and promote the health of individuals and the community. And the health policies can be used to formulate a new health policy for treating women with endometriosis. Next slide. Some examples of health policies include all women who show signs of endometriosis should be able to undergo laparoscopic surgery if they choose to. And second, all women who have endometriosis should have regular checkup at health clinics as this disease has no cure, so women are just told to deal with it and they don't have checkups presently. Secondly, we will be reorienting health services, and this can be used to provide better care for women who have endometriosis. They can also bring light to the services or lack of services being provided for women. The Trinidad and Tobago Endometriosis Association has programs in place to spread awareness of the disease. These programs include the Endometriosis Awareness and Education Program that is tailored for the general public and a secondary school program called the EndoTalk program. Next slide. Some things that the association can consider include, are these programs effective? Should the frequency of the programs increase? Is our message clear and concise? And are other services, and should other services be put in place? An example of other services include all nurses having proper knowledge of the disease, its symptoms, and how to properly treat it. This will make women feel more comfortable when talking about and coping with the disease, and they should also be able to feel welcome anytime they return for checkups and treatments. And third, we have empowering communities to achieve well-being. Communities and individuals can develop tools to help them cope with illnesses. They can look at both the long-term and short-term goals for achieving well-being. Given that endometriosis has no cure unless surgery is done, the Trinidad and Tobago Endometriosis Association can work to improve women's well-being. Next. This can be done by using community centers and schools to hold meetings with women who have endometriosis. This way, women can come together to support each other, encourage each other to get proper treatment, and live the healthiest life possible, both physically and mentally, while coping with the illness. Next slide. I'll now pass you back to Tahila to tell you about creating supportive environment.
So, creating supportive environments. It's important to create a supportive environment for young women with endometriosis. There can be meetings held where the members of the community are educated about endometriosis so its awareness would be increased. By doing so, it provides a way to connect with people who understand what they are going through firsthand. A supportive environment would help raise awareness of endometriosis by hanging posters near schools and in health buildings. There can also be local and online support groups for persons with endometriosis, and where these groups can provide emotional support for each other. Next slide. Developing or increasing personal health skills. Throughout much research, it was said that women with endometriosis were told to accept that they need to learn how to live with endometriosis, manage the chronic pain, and deal with infertility. By implementing these health promotion strategies, women can gain the knowledge they need to improve their quality of life while coping with this illness. Also, by increasing coping skills and regaining control of their lives, it effectively helps take care of some symptoms. Next slide. So what are some health or coping skills? Making healthy decisions is a big one. Foods that can influence hormone regulation, particularly estrogen balance, can negatively affect those with endometriosis. So it's important for endometriosis patients to pay special attention to their diets. Communicating effectively with their support groups. It helps raise a lot of stress off of their shoulders if they have someone that they can talk to, especially if it's someone who is going through something that they are experiencing as well, and they can relate to each other. They can expand their knowledge about endometriosis. So we can give them all the knowledge that we know, but doing personal research can help them find even more ways to cope with endometriosis and seek regular checkups. This is very important because it helps us determine whether or not the information being given is working or if it's not working. Next slide, please. Building alliances with special emphasis on the media. Many people use social media platforms to exchange information, and you can comment, share, and contribute to existing content that's online. With media such as television, radio, and print, the information gained would only be one-sided. As technology enhances communication about health, it's now available to everyone who needs it. Research revealed that many people with endometriosis have turned to online platforms in the face of lacking education and care. Despite the risks of misinformation and conflict on social media, the results of the research show that many people with endometriosis find these spaces beneficial, particularly for information sharing, social support, representation, and advocacy practices around endometriosis. I'll now pass you on.
For our conclusion, to summarize, we chose this topic because endometriosis is not discussed enough in our country. Women spend years quietly suffering from this illness because there is not efficient education being taught about it, nor is there enough support being offered for women suffering from it, whether that support be emotional or financial. Through the implementation of the Health Promotion Prevention Plan, we hope to resolve this issue by creating awareness among women nationwide about how to manage the illness, starting with the women of the Princeton area. We hope this presentation was informative and we thank you for your undivided attention. On these slides are our references. Thank you very much for watching.